guys, Dr. Hagmeyer here, and today I want to share with you a very special video on the 10 most common intestinal and gut issues that I see in practice in patients who have thyroid disease, Graves' disease, Hashimoto's disease, and in the 20 plus years that I've been practicing and working with patients with chronic health problems, these are the most common gut intestinal problems that we basically see on a daily to weekly basis. I'm going to go through what these are and help you understand more about each one of these. And if you go back and you visit my website, read the transcript of today's video, you'll have the links to each of these topics if you want more information on them. All right. The other thing I can tell you is that whether you're dealing with Hashimoto's disease, whether or not you've been diagnosed with Hashimoto's or Graves' disease, hypothyroidism or hyperthyroidism, you'll never correct or stabilize these thyroid autoimmune diseases until these gut and intestinal issues are addressed. That's how important the gut is. Right? You can't fix a thyroid or autoimmune disease if you don't know what kind of problem, what kind of gut problem that you're dealing with. All right, so let's get into these. First, I'll tell you what they are, and then I'll tell you and explain each one of them and their importance in thyroid and autoimmune diseases. And like I said, if you want more information on any of these, I'll leave a link in the description of today's video to the page where you can find the transcript and read more about these. So the 10 most common gut and intestinal problems seen in patients with thyroid disease and Hashimoto's and Graves' disease. And again, you might want to write these down. They're going to be gut dysbiosis, leaky gut, food sensitivities, small intestinal bacterial overgrowth, or SIBO, low stomach acid, yeast or fungal overgrowth, fat malabsorption, inflammation in the gut, low secretory IgA, low levels of short-chain fatty acids, and low levels of gut bacterial diversity. Right? And these two really kind of go hand in hand. One thing I can promise you is that if you have any of these intestinal and gut imbalances that you're going to learn about today, and you identify them and you work on correcting them, I promise you that your health will just skyrocket more than any drug a doctor could prescribe to you, and your health will improve in more ways than one. So let's go ahead, let's unpack these, and let's start with the first one, which is gut dysbiosis. So the thing with gut dysbiosis is we have this vicious cycle, right? We have this vicious cycle going on here. On one hand, we have low thyroid function, and that can lead to gut dysbiosis. And on the other hand, we have this gut dysbiosis that can suppress thyroid function and lead to autoimmune conditions like Hashimoto's disease and Graves' disease. It's hard to imagine right now, but you're carrying approximately anywhere between 4 to 5 pounds of bacteria in your colon, and your gut microbiome is home to hundreds of varieties of bacteria which are specific to the human body. And unfortunately, 70 million Americans suffer with some sort of gut problem in which they are making their gut an unhealthy place for all these bacteria to thrive. The medications, the antibiotics, all of these things that we take to treat the symptoms of these gut disorders only make matters worse. Now, because the lining of the digestive system is loaded with all kinds of immune system cells, and those immune system cells are part of an important barrier, poor gut health can be a significant trigger in the development of autoimmune diseases, including things like Hashimoto's disease and rheumatoid arthritis, multiple sclerosis, type 1 diabetes, inflammatory bowel diseases like Crohn's and ulcerative colitis, and many, many other metabolic disorders. But that's not all. A few weeks ago, I did a video titled How to Boost Thyroid Function by 60%. And it was a 2-part video series. And what I did is I talked about the role that the liver plays in converting T4 into T3. I talked about how to support the liver and many other topics related to the connection between your liver and your thyroid. But the liver is not the only place that conversion of T4 to T3 takes place. One thing I didn't talk about in that video was just how important the gut microbiome is to thyroid health. You see, it turns out that the liver is not the only place where this T4 to T3 conversion takes place. Another 20% of thyroid hormone conversion occurs peripherally in the intestines, but only if you have the right kinds of bacteria and if you're not dealing with gut dysbiosis or gut inflammation. You see, if you have gut dysbiosis or gut inflammation, you'll make less T3 hormones, and this could cause all those hypothyroid symptoms like fatigue and weight gain, anxiety, depression, hair loss, feeling cold all the time, and all those symptoms that you're probably familiar with and experiencing. You see, beneficial bacteria in the gut are not only needed for the conversion of T4 to T3, thyroid hormones, but these gut bacteria also play a major role in the modulation of Th1, Th2, and Th17 immune responses. And this is the connection that gut microbes and bacteria have with autoimmune diseases. These imbalances between Th1, Th2, and Th17 immune response is what is now understood to be one of the major triggers in the development of autoimmunity. So if you're following along with me here, then from a treatment perspective and a treatment standpoint, if you can identify those triggers behind that shift in Th1, Th2, Th17, you're going to stabilize an autoimmune disease and perhaps put that disease into remission, reduce the frequency of immune system flare-ups, and all of that's going to help you feel better and help you get your life back. Now, there are four main things that I want you to think about when it comes to the link between thyroid function and gut function, and why, if you have thyroid or an autoimmune disease, why you would benefit from functional testing and digging deeper into this thyroid gut health connection. The first thing I want you to understand and think about when it comes to the importance of gut health is that the majority of the immune system cells are located in the gut mucosal lining. So at the end of the day, regardless of what kind of thyroid problem you have or what kind of disease you have or what your diagnosis is, you really want to have a healthy mucosal lining. Number two, I already said this, but it's worth repeating, is that the gut is a major area, a major site where the conversion of T4 to T3 occurs. T3 is what the body uses, and this is why T3 is called the active thyroid hormone. Okay? Number three, bacteria found in our guts participate in the production of many different kinds of vitamins that become so important and vital to the balance of that Th1, Th2, and Th17 immune responses. And finally, number four, when it comes to the gut, deficiency in these vitamins are common, and ironically, these vitamin deficiencies perpetuate immune system dysfunction and a loss of mucosal tolerance. Now, I talked about this in past videos, but mucosal tolerance is one of the keys to immune system stabilization. For just a moment, think about the implications that poor gut health has on people who have autoimmune diseases like Graves' or Hashimoto's disease. If you have gut dysbiosis, you won't have the proper bacteria needed in your gut to make vitamins, such as your B vitamins, vitamin K, vitamin A, vitamin D, and all the others needed for proper functioning of the thyroid gland. And while I've done videos on the common nutritional deficiencies and how they relate specifically to thyroid and immune function, it's easy to say that correcting gut dysbiosis goes a long way in improving thyroid function, improving T4 to T3 conversion, improving the immune system barriers and balance, as well as improving the vitamin status. So that's number one, gut dysbiosis. Number 2 and 3 are leaky gut syndrome and food sensitivities. And these two problems are really very intimately connected and intertwined. You see, leaky gut has gained a lot of attention in the last 5 or 10 years, and for good reason. Leaky gut, also known as intestinal hyperpermeability, is another major problem to those who have autoimmune diseases, as well as thyroid disease. Earlier I mentioned the importance of the gut barrier to immune function. Now, if you look at this picture here, what you'll see is that when this protective barrier breaks down, it allows toxins, it allows bacteria, etc., to enter the bloodstream where they now come in contact with and provoke an immune system response. Your immune system is constantly patrolling your body and what's in it. Moment to moment, the air you breathe, the food that you eat, the medications you take, your immune system is making a decision in real time, on the fly, so to speak, as to whether or not something is a friend or if it's a foe. These foreign invaders have the potential to weaken these tight junctions and slip through the cracks. These invaders might be things like undigested food proteins. They might be things like casein, whey, and butyrophilin. Now, if you've never heard of these things before, these are the proteins that you find in milk, in butter, in cheese. Your whey protein shakes, for example, that you might be taking in the morning. In addition, individuals who test positive for these proteins, these are going to have an adverse effect on your thyroid and, again, ultimately on your immune system. Now, other food proteins found to be problematic to the immune system, especially when you have a leaky gut, include proteins that are found in gluten, in soy, corn, eggs, yeast, just to name a few. But foods are not the only problem. From an environmental and chemical standpoint, it's been shown that certain household toxins found in plastic containers and in our soaps, shampoos, deodorants, detergents can play a major role in triggering autoimmunity. These are going to be things like phthalates and bisphenol A, parabens. Research has also shown that exposure rates to certain heavy metals, such as mercury, cadmium, tin, arsenic, and lead, is much higher than expected, and that these heavy metals pose a very serious threat to our immune system. These chemicals, when they bind to proteins within our body, they form something called a hapten. And these haptens then can trigger various autoimmune diseases, including things like Hashimoto's disease and rheumatoid arthritis, and many others. Now, in a past video, I reviewed and went through causes of leaky gut, how to properly test for leaky gut, conditions that have been associated with a leaky gut. So again, if you want to know more information about leaky gut, I have plenty of information on my website that you can find and look up and go through. So again, be aware here, and what I would say is that the real takeaway here is that ultimately, by discovering and knowing and addressing what you as an individual is immunologically reactive to, whether it be a food sensitivity, a chemical sensitivity, or an environmental sensitivity, knowing this information can not only help you take massive changes in your dietary choices, but also to what extent you're willing to expose yourself to chemicals that you might use in your body or on your clothes and around your house and in your environment, right? That information can be one of the most powerful lifestyle interventions and steps that you can take towards better thyroid function, better immune function, and ultimately immune stabilization. You think about it like this: if you knew your immune system was reacting to parabens or phthalates or plastics or to dairy, whey, casein, cheese, or high levels of mercury and arsenic, I would guarantee that you would make a very, very conscious effort and a choice of removing all of those potential exposures at your workplace and at your home to minimize that exposure, right? You would not be crazy, or I should say you would be crazy to not to, right? Information is power. And without knowing what's triggering your thyroid and your autoimmune disease, how could you support or stabilize the immune system? So that's number 2, food sensitivities, and number 3, leaky gut. Now, the next intestinal problem that we see on a daily basis, problem number 4, and again, this is a problem that we see over and over and over again with those thyroid patients and Hashimoto's patients that we work with, is an overgrowth of bacteria in the small intestines. This is also known as SIBO, S-I-B-O. Normally, the small intestines are not home to these bacteria. However, with SIBO, bacteria in the large intestines will work their way up through a very special valve called the ileocecal valve. And that bacteria will move from the small intestines up into the large intestines. And again, like I said, this is in part due to the dysfunction of the ileocecal valve. Now, when these bacteria take up shop in the small intestines, the symptoms are identical to IBS, right? You get the bloating, you get the constipation, you get the abdominal pain, you get the cramping, you get the diarrhea. And if you notice these symptoms, especially when you eat things like fiber and starches and carbohydrates, then you might be suffering from SIBO and this bacterial overgrowth. Now, if you visit my website, on the right-hand side at the top of the page, you're going to see a section where it says quizzes. Under the quizzes, you'll see where it says SIBO quiz. If you click on SIBO quiz, it'll go through some of the most common symptoms and signs of SIBO. And when you're all done, it will tally up your score and determine the potential risk level that you have or the likelihood that you have SIBO. And then you can determine whether or not you want to be tested for SIBO and know for certain whether or not that's a problem or a contributing factor to the ultimate picture of your health. Now, the other thing about SIBO I want to tell you about is that many people with thyroid disease have SIBO or will go on to develop SIBO because of their thyroid medication. That's right, thyroid medication can cause SIBO. Now take a look at this study here that was published from the World Journal of Gastroenterology. Again, this was a study that was released in 2017, and if you look at the conclusion, it states this. It says the most important contributors for the development of SIBO was a compromised immune system, impairment of intestinal clearance, which is slow motility, and finally it says levothyroxine use. Now, if you're interested in learning more about SIBO, you can watch a video I did titled SIBO and its connection to the thyroid disease, or SIBO and its connection to thyroid disease. And if you're really interested in SIBO, there is a 10-part video series that I did that goes into so much more detail. All right, so SIBO is number 4. Unfortunately, for people with thyroid disease and Hashimoto's disease, another common gut intestinal problem that I see frequently is low stomach acid or an infection of H. pylori. And again, when someone has low production of stomach acid, you're more vulnerable to an infection with H. pylori. You see, hypothyroidism can lead to hypochlorhydria, which is the term used to describe when the stomach fails to produce sufficient amounts of stomach acid. Now, for many people with Hashimoto's disease, research shows that about 1 out of every 3 of them can develop antibodies against the cells that not only produce stomach acid, but also produce something called intrinsic factor. Now, here's why this is important. Intrinsic factor allows you to absorb vitamin B12. And what do we know about B12 and thyroid disease? We know that many people, or most people, 1 in 3, or at least most of those patients with Hashimoto's and hypothyroidism, have chronically low vitamin B12 levels. Now, I want you to listen very carefully about what I'm about to tell you because this is very important. If you have low B12 levels, or low iron levels, or low zinc levels, and you have a history of depression or other mental health problem, your doctor should be on the lookout for a condition called atrophic gastritis, as well as pernicious anemia. These are autoimmune diseases that commonly show up when someone has Hashimoto's disease, and the common denominator is low stomach acid. So again, just be aware of that and discuss that with your doctor. Now, there are a few more things that I want you to know about as it relates to the problems with low stomach acid. Okay? Low stomach acid creates several different kinds of problems for people, especially with thyroid disease. Number 1, if food, especially protein, are not properly digested due to insufficient stomach acid production, that protein sitting in your gut is going to putrefy and it becomes rancid in the stomach, and you'll most likely go on to develop symptoms like bloating and belching and burping and GERD and acid reflux. And while there are many other causes of low stomach acid, what is most troublesome is how insufficient stomach acid creates a snowball effect of problems in the lower GI tract. Because insufficient stomach acid affects the contents of the stomach, because now the contents of the stomach are not being properly sterilized. So now we can develop these infections like H. pylori that we just mentioned, right? Or they can develop other kinds of infections distally in the intestines. Now, another consequence of low production of stomach acid is its effects on the gallbladder. You see, low stomach acid can potentially cause the gallbladder not to release sufficient amounts of bile to help absorb all of those fat-soluble vitamins that we need for proper mucosal health. See, we're coming back to the mucosal health again. So again, fat-soluble vitamins, low stomach acid, leading to problems with that Th1, Th2, and Th17 immune response that we, again, were talking about earlier. So as a result, we end up with deficiencies of vitamins A, vitamin D, vitamin E, vitamin K. And again, how many people do we see that have thyroid problems that also have low levels of vitamin D on a regular basis, right? Less than 50. If so, that's a problem that needs to be explored. Again, because of insufficient stomach acid production, the small intestines can't properly digest this rotting mess of proteins. And this leads to inflammation. And this leads to things like leaky gut that we just talked about. It leads to gut dysbiosis. It leads to elevated cortisol levels. It leads to food allergies and small intestinal bacterial overgrowth. Essentially what we've done is we've created this mess. Because of low stomach acid, we have this cesspool in our guts, and that needs to be sterilized. But without that insufficient production, with insufficient production of stomach acid, we don't digest protein. We don't digest fat. This is one of the many reasons why thyroid patients also struggle not only with H. pylori, but they also struggle with the bloating and gas and constipation. And again, why 50% of people that have thyroid disease have IBS. right? So another common GI problem that I frequently see in patients with thyroid disease is yeast and fungal overgrowth. This is number 6. Many times with dysbiosis, various strains of yeast like Candida albicans become dominant in the gut. And essentially the yeast takes over and it overwhelms the natural populations of good bacteria that are part of the microbiome. This is called fungal dysbiosis, and many times this accompanies SIBO. So not only do we see SIBO, which is small intestinal bacterial overgrowth, we also see small intestinal fungal overgrowth. Okay? Now with yeast overgrowth, symptoms can vary widely from person to person, but the most common symptoms that I would start thinking about if you suspect a fungal overgrowth, yeast, is things like sugar cravings, fatigue, depression, headaches, brain fog, and sometimes the sensation of actually feeling hungover, as well as bloating and constipation, some of those other GI issues. Now remember that yeast can produce over 100 different kinds of toxins, and ultimately this is why the symptoms are so different from person to person, person to person. Again, so that's something that you should be aware of. Now the other thing is this: if you suspect that you have a yeast overgrowth, just like that SIBO quiz that I just told you about, if you visit my website and look for the Candida quiz, you can go through that, you can answer those questions, and when you're all done, you can submit that questionnaire. And within just a few minutes, you'll get an email with your score indicating the risk or the likelihood of a fungal overgrowth and potentially whether or not you have Candida. And again, you can then determine whether or not you want to take the next step and get tested. So number 6 on our top 10 list of most common intestinal imbalances seen in patients with thyroid disease and Hashimoto's disease. Another common problem that we see is fat malabsorption and gallbladder disease. So this is number 7. Liver function and gallbladder function are essential for the proper breakdown of fats. However, if these fats are not properly broken down, you'll suffer with fat malabsorption. Now let me show you an example of a patient who has fat malabsorption. What you see here is that all of these levels are in the 5th quintile distribution. His triglycerides are high, his long-chain fatty acids are high, cholesterol is high, and the top marker that says pancreatic elastase 1 says 185. This level should be over 500. So I know it says it should be over 200, but healthy people have levels that are over 500. So at 185, this person is very low in pancreatic elastase enzyme. Now, for this patient, this has created major digestive problems. Fat malabsorption means fat-soluble vitamin deficiencies. Again, vitamins A, D, E, and K, as well as all of those good omega-3 anti-inflammatory fats. All of those good fats are not getting properly absorbed if we have fat malabsorption. Now, in addition to fat malabsorption, many of my thyroid patients have gallbladder problems or they've had their gallbladder removed. In fact, my wife was a casualty to having gallbladder disease and having to have her gallbladder removed. Right? So if your gallbladder is not functioning optimally due to thyroid disease, your bile, which is made in the liver and helps you break down fats, can become saturated with cholesterol. And then this cholesterol can crystallize and that forms the gallstones. Now when the stones get big enough, they now can block your bile ducts, causing gallbladder disease. The other problem that we see is that when we reduce bile flow, for whatever reason, we slow down peristalsis. Now peristalsis are those wave-like contractions or muscular movements that propel food and bacteria and waste and old cells along the digestive system. If peristalsis is reduced, you'll develop constipation. And with that constipation, you now again create that cesspool where you can develop SIBO. Hopefully, what you're starting to see here is how many of these gut and intestinal problems, so common in thyroid disease, are all intertwined and connected. This is why using medication to treat the symptoms only makes all of this worse. If you don't get to the root cause of these problems and identify them, you wind up dealing with multiple problems at the same time. And by the time most people finally reach out to me, that's what I'm dealing with. I'm dealing with a multitude of problems. And again, many of these GI issues are going on simultaneously. That's also something to keep in track. So again, keep in mind that when you take medications for these problems, this is just like taking the dirt and sweeping it under the rug. At some point in time, you need to take and pick up the dirt that's under that rug, right? So fat malabsorption and gallbladder problems together were number 7. Now, moving on to number 8. Number 8 is inflammation. Inflammation, autoimmune diseases go hand in hand, right? At the root of hypothyroidism and Hashimoto's disease, and really all chronic diseases, is inflammation. Now, inflammation is your thyroid's worst enemy, but let me explain why inflammation can suppress why inflammation is such a devastating scenario going on in a person's body. For number 1, inflammation suppresses the feedback loops between your brain and your thyroid gland. And by suppressing those feedback loops between your brain and your thyroid, you have less TSH. Remember, TSH stands for thyroid stimulating hormone. So the less TSH that you have circulating in the blood, that means you're going to have a very, very weak signal going to the thyroid gland, which shows up as low thyroid production, low thyroid hormone production. So that's the first problem. The other problem is that inflammation drives these chemical messengers called cytokines. And this causes an increase in something called reverse T3. Now, reverse T3 is different than T3 that your thyroid makes, but it's similar enough to bind to the receptor sites that are designed for T3. So what happens here is that we have high levels of reverse T3 competitively competing with the binding sites that are designed for T3. And ultimately, this leaves you in a low thyroid state. Now, the other thing inflammation causes is more cortisol production, right? And this ultimately wears out and drains your adrenal glands, leading to extreme fatigue and anxiety and depression and weight gain and heart palpitations and low libido and many of the other symptoms that you might be familiar with if you look at adrenal stress or adrenal fatigue syndrome. Now, the other thing is that adrenal fatigue is more and more people are starting to call this adrenal fatigue or this adrenal stress HPA dysfunction. And that's what it's being called. So if you start to look for adrenal fatigue, you can also start looking up HPA dysfunction. Inflammation also increases something called oxidative stress, which damages the cells and depletes ATP. ATP is the cellular energy within the cells of your body, right? You're alive because your cells are generating ATP for all the different kinds of cellular functions that are going on, right? We also know that inflammation causes a leaky gut, right? Inflammation can affect the pituitary gland and cause less dopamine and less serotonin production, leading to depression and anxiety, as well as increase things like pain and overall a loss of enthusiasm and excitement in life. Now, interestingly enough, and this is just a little side note here, is that in the brain, dopamine is actually needed not only to make TSH, but dopamine is also needed to convert T4 into T3. So here we have a situation where low dopamine in the brain affects thyroid function. Again, are you having trouble sleeping? Are you having inflammation that reduces melatonin production, which shows up as an insomnia and irritability and brain fog? You see, in a nutshell, the combination of inflammation, decreasing TSH levels, decreasing thyroid gland production, causing competition between T3 and reverse T3 receptor sites, lowering dopamine levels in the brain. This is a disaster for anyone who has Hashimoto's disease or low thyroid. And if this is the only video that you've ever watched of mine on YouTube, I hope what you're starting to see is how ridiculous this mindset that pervades through the traditional model of medicine, that simply replacing these lost thyroid hormones is the answer or the fix to correcting thyroid disease. You see, topping off thyroid levels is not like topping off the oil levels in your car. You need to work with a functional medicine doctor who understands the complexity of this and goes way beyond just saying, take this T3 replacement, take this Synthroid, take this levothyroxine. This is so much bigger than simply replacing low levels of thyroid hormones. All right. Now, if you're interested in learning more about inflammation, again, I did a video titled Inflammation, Your Thyroid's Worst Enemy. And really, again, this is a two-part video where I explain some of the causes of inflammation, the markers that I like to run on patients with Hashimoto's disease, the causes of inflammation, some of the supplements that can help with inflammation. Okay, so that was inflammation number 8. The last two GI issues that I want to share with you that I see in patients again over and over and over again, and chances are you've probably never heard of this, is something called secretory immunoglobulin A. Right? This is also known as secretory IgA or SIgA for short. But ultimately, secretory IgA is especially important for individuals with autoimmune diseases. Right? If you're dealing with multiple autoimmune diseases or food intolerances or chemical sensitivity, mucosal intolerances, again, keep in mind that mucosal surfaces cover a major part of the body: the digestive system, the urinary tract, the nose, the mouth, the sinuses, the inner lining of the ears, the vaginal tract, the throat. Again, these are all prime examples where the mucosal layer plays a critical role in supporting our immune system health. These mucosal surfaces of your body are the first line of protection against invaders, and these surfaces are equipped with specialized cells called B cells. These B cells produce secretory IgA, and having high or low secretory IgA levels is a sign of compromised mucosal immunity, especially when these levels are low. Now I want to show you something. If you look here, here's an example of a patient of mine who we originally tested back on 5/20 of 2018, and what you see here is with the secretory IgA levels was that they were incredibly low. They were 130, and over the next 12 months, we worked on a lot of different things with this patient to correct his gut health. We worked on his diet, improving what he was eating. We eliminated a bunch of foods. We worked on things like leaky gut. We worked on various vitamin deficiencies and vitamin levels. We worked on food sensitivities. This patient had high levels of oxidative stress. We worked on those. We worked on gut dysbiosis. We worked on inflammation. We removed environmental toxins. We cleared out many of the parasites that we picked up. But here is his post-test, which was so exciting. And you can see that these levels improved drastically, right? But we had a lot of work to do with this patient before we got him to this point. Notice that his levels went from 130 micrograms per gram, which is incredibly low, to 1,625 micrograms per gram, which is exactly where I like to see them. These are right in the middle of the range, and this was great, robust, strong level for this patient. This is a great sign that the immune system is stronger, it's more balanced, it's more stabilized. Now, there are many things that can affect your secretory IgA levels, and the more things you understand behind the cause, the better your chances are of correcting the problems, right? You can't fix what you don't know. So low levels of secretory IgA, number 9 on our list, is the most common intestinal imbalance that we see in patients with thyroid disease and Hashimoto's. And finally, we're at number 10. And number 10 is absolutely vital to not only gut health, but when you look at the studies, things like cancer and things like metabolic syndrome and insulin resistance and heart disease, inflammatory bowel disease, neurological and degenerative diseases, autism, ADD, ADHD, these are all connected to low levels of short-chain fatty acids and a reduction in gut bacterial diversity. There is now an abundance of research that shows that short-chain fatty acids and gut microbial diversity plays an integral role in the maintenance of health and the development of disease. And unfortunately, when it comes to diets that very often people who have autoimmune diseases need to follow, or perhaps people with metabolic problems like insulin resistance or heart disease, they follow diets like ketogenic diets or low FODMAP diets or AIP diets. Unfortunately, these diets not only can they be incredibly helpful, but the flip side to this is for those patients with those problems, what we often see, because those diets are so restrictive, that they reduce microbial diversity and they reduce the low levels of short-chain fatty acids. And that's, again, unfortunately, because these diets limit and they restrict things like fruits and nuts and seeds and grains and various vegetables that are high in fiber, that are known to increase the levels of short-chain fatty acids and improve microbial diversity. If you look at this test that I ran on a patient, you can see here that this patient had low levels of short-chain fatty acids. And this created some unique challenges because this patient not only had Hashimoto's disease, but this person also had SIBO. They also had that small intestinal bacterial overgrowth that I was talking about. And the problem with this is that people with SIBO, or this small intestinal bacterial overgrowth, they can't tolerate fiber, fruits, sugars, and starches. In fact, the more fiber, fruits, sugars, and starches that they eat and that you give to this person, the more you feed the bacteria and cause even greater bacterial overgrowth, right? So short-chain fatty acids are the production, or I should say short-chain fatty acids are produced by the gut microbiota during the fermentation process of starches. So as starches and carbohydrates are broken down, they release these short-chain fatty acids. And again, these are some of the most powerful gut signaling compounds that we are aware of, right? There's a tremendous impact that, again, they have on brain health and hormones and immune function and cardiovascular diseases and even losing weight, right? So for people who have both SIBO and have Hashimoto's, this becomes a vicious cycle. So ultimately, this person needs fiber and they need starches in order to increase the gut microbial diversity and improve short-chain fatty acids. But by eating these foods, you increase the bacterial load and cause some very uncomfortable symptoms and very often painful bloating and painful constipation, which again, all of this in turn further adversely affects thyroid and immune function, which is why I tell you this. Now, if you're someone who suffers with insulin resistance or weight gain, prone to storing fat rather than burning fat, right, you might be having problems with microbial diversity and low levels of short-chain fatty acids. So if you hung in here for all 10 types of intestinal imbalances seen in patients with thyroid disease and Hashimoto's disease, I am super proud of you. I hope this video helped explain why you're still struggling with thyroid disease or Hashimoto's disease and why you may not be exactly where you want to be with your health. I wish I could tell you exactly how to treat each of these conditions that I talked about today, but it's much more complicated than just changing your diet and taking XYZ supplements for this condition or for that condition. When tackling these problems head on, you have to look at the root cause. And of course, there are no shortcuts to any of this. There are no cookie cutter approaches that you can follow on the internet from a Facebook group. And again, this is why you need to work with an experienced functional medicine practitioner and get the proper testing. Facebook groups really are the blind leading the blind. Finally, keep in mind that chronic health problems like autoimmune diseases are very complex, and there are many layers, and the more pieces of your health puzzle that you've uncovered and that you've identified and that you can work on, the easier it is for you to understand how it is to get better, right? You can have incredible health, that much I can promise, but it starts with identifying where your problems are. I hope that you'll subscribe to my YouTube channel. I know this was a long video. I'm proud if you made it all the way to this point. We'll see you again. Take care.